Hi guys, how are you doing? This is Dr. Deepak Marwa. I would like to talk about some very relevant issues important for your medical career. In fact, in this discussion, I'll be giving you 5 important hacks which are important for you to be able to complete your entire internal medicine syllabus on time. Before I begin with the hacks, I would like to share my personal experience. When I went to a medical school right from first year, all I experienced was stress because there was so much to study, so much to cover that I was having difficulty in coping up. I'm sure most of you can relate to what I'm saying. Most of doctors are stressed out, and the levels of cortisol in blood of most doctors is spiking much more than of general population. You see, doctors are not meant to operate on cortisol because that is for ordinary human beings to be able to handle stress. We are going to be making life saving decisions. We are going to be saving somebody's life. We are going to perform at a level higher than ordinary citizen of India or ordinary population. So for you to learn, imbibe the data, and then be able to save somebody's life, you will be using the higher mental functions, the skills of your neocortex. And in your neocortex, I would like that after listening to this discussion, there would be enhanced electrical activity. I want a higher level of neurotransmitters in your brain like dopamine and serotonin, which would be spiking and would be improving the performance of your neural circuits. So, how is it possible? I'll be giving you a roadmap of 15 days in which I would like you to cover the entire syllabus. If you're exam going, it is 15 days. If you are in a final year or let me say a third year student, obviously you can take a relatively longer time, but definitely not more than a month. Because if you're going to take it longer, it's going to keep on lingering and therefore the subject never gets completed and you would never realize if you are rather in your third year when final year has come, when internship has started, and because of all the hectic duties that we have to do nowadays, most people tend to go into the exam unprepared, and at the moment those 15 days might look to you as less, but believe me, you can make every hour count. Each and every movement matters. And one of the important things that I'll be teaching you in this discussion is about internet blackness. What I mean by internet blackness is that you need to get off the social media because social media is like an energy vampire. That is going to decrease your productivity, that is going to decrease your performance. So I want you to be listening to me with utmost care because I'll be telling you some very important things which are very relevant for enhanced productivity of yours. So hack number 1 that I want to discuss with you is called as all or none law. I would like you to finish the entire internal medicine module in 15 days. You see, right on the first day, everybody is like, yo man, I'm gonna do it. But from the second day, third day, fourth day, the productivity starts decreasing. And most of the time I find by the 5th day, people give up. I would like to divide this training into 3 parts. The first 5 days are the hardest. Why they are hardest? Because you are changing your habits. You see, change of habits is obviously troublesome. So most people, they use the app for the first few days with a lot of enthusiasm, then they stop it midway, and that is not to be done. Believe me, if you are going to use this internal medicine app daily for the next 5 days, this is going to become a habit for you. Forming a new habit takes minimum of 5 days, and obviously as you will get used to the things that I'm rather teaching you, maybe by the end of the 10th day, you would be rather yearning to learn more. I assure you the fact that if we divide this training program into first 5 days, 5 to 10 days, and 10 to 15 days, I want your performance to remain static. What I mean by static is it is daily of 8 to 12 hours of study. I'll be teaching you how many days to dedicate to cardiology, how many days to dedicate to neurology. But first and foremost, I want you to imbibe in your brain this basic fact that whatever has to be done has to be completed. Like you can see a picture here. I have just put a Hindi caption here from this movie, Half Girlfriend. Nobody wants a half girlfriend, right? I mean, it says, आना है तो पूरी तरीके से आना वरना मत आना. So the same attitude, right? I mean, you want, if I'll put it like this, if you want to be happy in a relationship, relationships are always gonna work if two people are professionally satisfied. If they're professionally insatisfied, it's always rather a unhappy marriage, a unhealthy blame game always going on. In fact, because I have highlighted this fact that it is all or none law, I would just like to read an email here that was sent to me by one of my students, and he sent me right in the middle of the year. You can see the date, that is 19th of June, and this is from Dr. J. Cathion, and see what he says. And why I'm discussing this mail is mainly to highlight that middle of the year he's already done with internal medicine. He says, I have just finished watching all the videos of preparatory medicine. I want to thank you as your lectures were good, conceptual, absorbable, and wish I could have seen it from my third prof. So I want to point to those of you who are starting early. It is important that you dedicate a particular number of days to listening to this particular information from internal medicine app on a regular basis. If you will break the continuity, the information will get washed out. He says the way you conceptualize the topics are beyond words. I don't think anybody can explain what, when, how of every single statements they make. In this app, I'll be explaining to you why it happens, how the disease will progress. So I want you to listen to this app with utmost dedication and have a complete internet blackness. In this particular device that you are using to use this app, there should be no social media. There should be no Tinder, no Facebook, no WhatsApp on this, because otherwise you will continuously keep on getting notifications in between, and that will destroy your concentration. He has talked about a couple of relevant issues also, like he found cardiology a little difficult. As far as the rest of the subjects, they went on pretty smoothly. But what I want to highlight in this particular email is that right in the middle of the year, he is done with the first read. My app is not only being used by final year students or people who are sitting for a PG entrance exam, even people who have completed or rather are in the process of doing their MD medicine are using my app. I would like to share another email before you from a doctor by name of Dr. Karamveer Singh Dhillon. He's from Amritsar. He's a third year MD medicine resident. He says, I want to acknowledge that I've been able to understand medicine in a sustainable way. Now, why am I reading of this mail before you is not that I want to praise myself, but I want to tell you that this chap who is having all the knowledge, all the books he has read, but still he's using this app. Why? Because this gives you concise information. It tells you the gist of the disease. It tells you why the disease develops and what are you gonna supposed to do for it. So I would like to highlight the fact that if you're going to use this app, you're going to understand the disease process. He has specially requested me here to actually make a video for especially postgraduates who are doing their MD medicine. But at the same time, the basic point of reading out this email before you was to highlight the fact that consistency on a regular basis matters. Now, hack number 2 for your preparation is eat that frog. You see the slimy frog, we do experiments in physiology with a frog. You know how, I would say, ugly a frog would look and how slimy it would feel in your hands. But here I'm saying that if I am gonna achieve a particular level, and if I only have a frog to eat and I have something more delicious to eat, what will I eat first? I will not eat the delicious item. I will first eat that frog. Why? Because most people, when they start using the app, they start going to easier topics. They start reading GI. Now, GI is something that you read even in pathology, no? I mean, you read about Peutz Jeghers, you've read about familial adenomatous polyposis, you've read about angiodysplasia of the colon. Don't start with the easier topic like, I would say, GI tract. Don't start with easier topic like hematology, because you've done that in pathology. Rather, straight away start with cardiology. I'll explain to you what are the important topics to be read in cardiology, but one of the important things or the important hack that I want you to understand is eat that frog. Now, please understand, I eat that frog right in the morning when I'm maximum fresh. Most doctors I have seen, they tend to study late nights and then they wake up late. This is not to be done because exam occurs in morning hours. You have to be maximum fresh in the morning hours. So ensure the fact that you are rather starting your day as early as, let me say, 8 a.m. in the morning. So your sessions are going to be like at least 3 to 4 hours of continuous study. You might read about Pomodoro technique and a lot of other hacks of studying 20-25 minutes. For smaller subjects, that is okay. But for subjects like internal medicine, for surgery, it is all or none law. I have to finish the topic and the topic can't be finished in 25 minutes. If you give a break in between, you will lose the continuity. And exam duration is 2.5 hours. I assure you the fact, most chaps know when they are sitting for the actual exam, they get tired in the second hour. First hour performance, everybody's performance is equal, but with the second hour the performance starts going down. Why? Because they don't have the physical stamina to sit that long. So if you're going to do 25 minutes of study, 5 minutes of gaming on the internet or something like that, rather it will fatigue your brain out more. Checking out social media will make you realize that everybody else in their life is enjoying and I am the only one that is studying. That will make you feel more pathetic. So rather, apart from the internet blackness, I want you to understand, start with the subjects and the topics that you are not comfortable with right in the morning. And if I eat two frogs, what is the two frogs that I'm talking about? Cardiology and neurology. If I'm going to dedicate half a day to let me study cardiology, let me say bundle branch block, and the remaining half day I want to study about epilepsies and the drugs that are used for management and the EEG interpretation, I would like to do or eat the bigger frog first. Now bigger can be, varying from person to person. Some people are rather comfortable with neuro, not comfortable with cardio. Some people are comfortable with both the subjects, some people are comfortable with none of these. But I would like to handle the most difficult subtopic for me. I'll put my hand on my heart and say, okay, this is the most difficult subtopic of internal medicine for me. I'm going to handle that first. Here, I want to share another email with you. This is from Vidisha. She's written to me on 18th of June 2020. She says the fact that she had already decided in her final year that she will take up pediatrics. She says, medicine was not even in my farthest dreams. I struggled with the subject in the final year. I spent the maximum time on internal medicine and my scores were the worst. She hated internal medicine. But then she says, I subscribed to Prep Ladder. I did rapid revision. I listened to your lectures and I started liking them to the level that I have now selected MD medicine. Imagine, I am discussing this with you to tell you about a girl who hated internal medicine and this was her weakest subject. In final year, she scored the worst in internal medicine in final year, but then subsequently, because she developed a habit of listening to the lectures, she started analyzing the data. Therefore, her performance definitely increased, her productivity increased, and this girl who hated internal medicine has selected MD medicine now as her final destination. So, do not be under an impression that this subject is either my cup of tea or not my cup of tea. All 19 subjects are to be used by you to make a beautiful painting of your career. You see, in a rainbow there are 7 colors, but you are having 19 subjects to paint a beautiful painting of your career, and you're gonna hang that painting. Whenever you wanna look at it, you're gonna realize that I put my heart and soul into this preparation. So hack number 1 is all or none law. Hack number 2 is eat the frog. Whichever subtopics you hate are to be done first. Hack number 3 is perform your mind analysis. Well, here I would like to go into common reasons that dishearten the doctors. The most important, and rather I would like to say, what I personally also went through was constant comparison with peers. My colleagues in MAMC Mulana's Medical College were highly intelligent chaps. They used to gobble up and finish Robbins and Harrison and Davidson CMDT in record times, and I used to be maybe struggling at midway. They had completed the topic maybe twice and I had done the topic only 50%. So I was always comparing myself with my peers, and I initially realized that I was going into a depression, but then I realized that everybody has a different speed of reading. You see, if you will constantly compare with your peers, if you will constantly compare yourself with toppers of a particular interview, there's a possibility that because your course is not getting finished, you will get bored. So what will you do? You'll pick up your mobile phone and you will start scrolling furiously on Instagram, on Facebook, on Tinder, or something like that, left swipe, right swipe, and you would be seeing other people enjoying their life, posting their pictures on a holiday, and you would be saying, oh, what the hell, I'm sitting in a nondescript room and I'm studying. We doctors are sacrificing an important part of our life to be able to save somebody's life. I want you to make that every hour count. Please appreciate that if the topics are not completed on a particular day, stress comes in. And when stress comes in, then I would put it like this, then the next day is even worse. Because then you keep on thinking about, oh, yesterday I did not complete a particular topic and my friend has completed it, so I'll not be able to do much. You have to make timetables, and I'm going to give you a ready-made schedule here of how you're going to spend 15 days with this particular app on a regular basis. Please appreciate, all of you were college, or rather I would put it like this, all of you were toppers in your school. But when you come into college, that is when only few people remain toppers, and the remaining people either become mediocre or rather become below average also. Why is that happening? That is happening simply because of the fact that you have the intelligence, you have the IQ, but because you're constantly comparing and looking at what the other person is doing, you are not focusing on what you can do. Therefore, what are the solutions for it? The first and the most important solution, which I tried on myself, and it always works, is talking to yourself. You have to stand in front of the mirror in the bathroom and talk to yourself and pump yourself up, something like what Rahul Dravid used to do or Sachin Tendulkar used to do, and when they had to go out and pace out, fast bowlers like Shoaib Akhtar. If you follow cricket, I think you can understand what I'm saying. Or let me give example of Ronaldo or Messi. They are the best football players. You see, even in a lockdown, Ronaldo was still working out. You would be surprised to know that Ronaldo's performance during the workout, his muscle performance increased by 10% during the lockout. I mean, during the lockdown period, everybody was relaxing, everybody was having all kind of junk food, or everybody was sitting at home not doing anything. But Ronaldo ensured, and you can search for this on Google, Ronaldo ensured the fact that he uses the lockdown period to enhance his muscle strength. He did a lot of exercise in the muscle strength, and the doctors in the football club were surprised when they evaluated his muscle performance after the lockdown opened, that his performance had gone up by 10%. I want you to be calm and confident as Ronaldo, calm and confident like Rahul Dravid and Sachin Tendulkar, not like Virat Kohli. Not that Virat Kohli is not a good guy, but just the fact that he uses abusive words. Don't learn sledging. Don't criticize your college mates. Don't gossip. Don't talk about other people. Let them do whatever they're doing in your college. Let them do whatever they're doing with their lives. Don't learn sledging. Don't use the F word. Don't be abusive. In Punjabi, there's a song by the name of Gal Nahi Karni. So please appreciate that if you are abusing somebody, if you're using the F word, if you're using the wrong word, what happens is it puts negativity in you. You would not then be able to match up to the performance of your peers. I want you to be strong, mentally fit all the time, and always have smile on your face. Be kind to people, be kind to your patients, and that is possible with talking to yourself every single day of your life and telling you that, okay, these are the list of topics that have to be completed. Hack number 4 is what I've already highlighted right in the beginning, that social media drains your brain. I will use the word here, energy vampires. They suck out your energy. They suck out the energy from your brain. So if you think that you're going to play a video game and feel refreshed, no sir, it's not happening. That is rather tiring your eyes out, your eye muscles out, because when you sit in front of a computer and you give a grand test, after 2 hours, mental fatigue comes in and physical fatigue also comes in. I mean, people, they start moving left in the chair, right in the chair, because continuously sitting for 2 hours is also difficult. Believe me, a lot of people don't even have the stamina to sit for 3 consecutive hours in the exam. Physical stamina. Mental stamina comes later. So you need to have long sitting hours. That enhances your ability to focus. Believe me, I'm not saying that right from the first day you can sit 3 hours, but yeah, you can start with maybe 30 minutes, pump it up to 45 minutes, upgrade to 1 hour, 1.5 hour, but gradually keep on increasing your back muscle performance and your mental performance on a regular basis. Otherwise, checking out on the phone every 15 minutes, 20 minutes, how many COVID-19 cases have gone up in Delhi versus Mumbai versus Tamil Nadu is not going to enhance your performance. I mean, you commenting on social media about how Indian government is handling the COVID-19 pandemic is not going to change the way the government is handling it. So if you can make a difference, yes, go ahead and take those steps. But simply commenting on social media and being a social media tiger does not make or rather increase your productivity or rather increases your performance. The most important hack, I'll repeat the hacks. First thing, the important thing is all or none law. If I have to complete a topic, I will complete it. Eat the frog. Whichever topic I hate, I will read that first. For the third point or the fourth point, I've spoken about them already, but one of the important words that I taught you was energy vampires. Energy vampires could be your college friends whom you are always looking at and comparing yourself with. Energy vampires could be your mobile phone. Energy vampires could be a family member, but you have to ensure that they are not able to affect you. You want to talk to yourself. Wake up with determination and go to bed with satisfaction. Believe me, the day you go to bed with satisfaction that yes, I've studied so much that I can't study anything more. If you studied 10 hours, 12 hours today, you will go to bed comfortably. And if you are at night time listening to what I'm saying at the moment and you are not satisfied with yourself, spend 1 hour on the app, listen to a topic, listen to congestive heart failure, listen to bundle branch block, but listen to some topic at least so that mental fatigue comes in, so that you are able to complete with and rather sleep with satisfaction that yes, I completed this topic, now I can sleep satisfied. Because if you're not gonna sleep satisfied and you're going to be tossing and turning in the bed because anyway you're not feeling great, and maybe the next day when you wake up you might be irritated, you might be snapping at your family member, you might be snapping at your friend, or you might just be becoming a shell, you might become too introvert and you would not like to talk to anybody. So please appreciate the fact that if you have to wake up with satisfaction, you have to definitely go to bed. You have to go to bed with extreme amount of mental fatigue. I mean, इतना पढ़ लेना कि आपका दिमाग थक जाए. और मैं तो आपको ओपन चैलेंज दे रहा हूँ आज, क्योंकि आप ये मेरी ऐप को फर्स्ट टाइम सुन रहे हो, तो ओपन चैलेंज इज डोंट स्लीप द होल नाइट. Don't sleep the whole night, study the whole night. Nothing is going to happen to you the next day, even if you don't sleep the whole night, simply because of the fact that if you have programmed your brain in this fashion, that I am going to study the whole night and I'm going to be fresh the next day, I'm going to go and attend medical college posting, and I'm going to come back and again use the app or study. I mean, it's all in the brain. If I say, okay, I did not sleep properly last night, so I'm feeling irritated today, obviously my today is also gone. But if I've decided in my mind that, okay, whatever that happened yesterday is over, but today is what matters, that is the attitude that I want you to develop. Now, coming to the specifics, where to start reading, the message is take the bull by the horns. We're going to start with cardiology, the very basis of being a doctor. You see, whole world is nowadays treating pulmonary edema. It's caused by COVID-19. It's a non-cardiogenic pulmonary edema, but you have to understand what is cardiogenic pulmonary edema and what is non-cardiogenic pulmonary edema. So my suggestion is go on, read congestive heart failure, read ARDS in comparison, so that at least you get an idea about how the whole world is crazily treating pulmonary edema and we are still fighting. While I'm discussing this, shooting this video, I mean the world is struggling to find a cure. Lectures of cardiology can be listened at 1.2x speed. Yes, possible 1.2x speed with ready-made notes kept in front of you. If you're making yourself handwritten notes, you have to obviously listen at maybe 1 or 0.8x. But if you're using the printed version of the notes, you can listen to the lectures at 1.2x speed, because that will put stress on your brain. When I'm using the word stress here, I'm saying you are enhancing the performance of your neocortex. You are making your neurons work harder. You are, I would say, rewiring your neurons in a fashion that they're able to perform relatively better. And that is, as I said in the beginning, I mean, the neurotransmitters of learning are serotonin and dopamine. They give you pleasure in reading. They make you feel satisfied, and that comes with regular practice. Now, how many hours are you going to study every day? The theory part is minimum 8 hours. That would be 2 slots of 4 hours each. So it's going to be 8 a.m. to 12 a.m. with focuser. Make every minute count. In 1 hour of study, at least 50 minutes concentration should be in the app. I understand, our mind gets distracted. There might be something happened at house, so you might be remembering it. There might be some song playing in your mind. So, 5-10 minutes in 1 hour is understandable. You can lose concentration, but at least I expect 50 minutes of concentration in 1 hour. So, your first slot is at least starting from 8 a.m. to 12 a.m. and then subsequently from 2 p.m. to 6 p.m. And at least I assure you the fact, you see 8 to 6 and you're done with 8 hours of study. A lot of us, including myself, my day used to start at, let me say, 7 in the morning, go to medical college, come back. The whole day used to be get over and I hardly had studied anything. But here I am saying that you have to make every hour count. So please ensure the fact that if you are sitting down for a PG entrance exam and preparing, you have to dedicate at least 8 hours into theory, 3 hours into MCQ solving of the same topic. Don't postpone. Don't postpone. I'll also teach you how to do MCQs. Don't postpone, but at least dedicate 3 hours into MCQ solving of the topic that you studied, that is cardiology, and 1 hour can be dedicated to revision of what I did yesterday. I'll also tell you how are you going to do that revision part, but your day should be at least 12 hours of data crunching. That neocortex, the neurons of yours are gonna crazily work, and believe me, if you do this regularly, 5-6 days of regular work is all that is required. Human brain adapts very fast. We have neuroplasticity. The adaptation occurs very fast. If you do something regularly for just 5 days, your brain adapts very fast. We human beings are extremely adaptable. Coming to ECG based questions, definitely a nightmare when you're doing it for first time. So first I would tell you what are the important conditions, and there are only 10. Nobody expects you to be a cardiologist, but you have to do these topics that I've highlighted and are flashing on the screen. Atrial fibrillation versus multifocal atrial tachycardia. Both have irregular heart rate. You need to differentiate what is the difference between AFib and MAT, and that is in the app. Then atrial flutter, PSVT, I want you to understand differences between AV nodal reentrant tachycardia and atrioventricular reentrant tachycardia. Listen to my words again. AV nodal reentrant tachycardia, and AV is atrioventricular reentrant tachycardia. Then is the routine stuff like Wolff-Parkinson-White syndrome, Langenau-Levine, ventricular tachycardia, TDP, ventricular fibrillation, heart blocks of all varieties, electrical alterance, and yes, electrolyte imbalances and their impact on ECG tracing. A large number of questions are asked from there. But if you are done with these 10, and if you're able to identify these 10 ECGs, that is more than sufficient. Now, whenever you will do a ECG based question, you have to not try to play Sherlock Holmes right from the word go and start scanning for findings, because lots of time your eye may not be able to locate the findings in that graph. So don't try to do all ECG based questions in a single day. Don't only do about 10 to 12 or maybe 15 maximum per day. Directly read the explanation of the ECG based question. I have ensured the fact that I made markings in the ECG. When you will read the explanations, there will be like markings given that, okay, this is electrical alternance, this is hyperacute T wave, this is tall tented T wave, because hyperacute T wave and tall tented T waves are different. ST elevation, how it looks like, ST depression, how it looks like. So I have hand drawn that in the app, so that I can at least make you understand what is going on. So when you're doing a ECG based question, read the explanation directly of the question and notice the subtle findings. Note down the subtle findings in 1 or 2 lines in a separate register, and next day when you wake up, then read those findings and re-attempt those ECG based questions again. Your eyes will now start looking for those findings. See, ECG is a skill. It can't be developed over one day. It can't be that, okay, I tell you a method right from, let me say, listening, at the end of 2 hours you start picking up findings. It is a daily activity. So when you spread this over the next 4 days, I assure you the fact that your eyes will start going towards the findings. Your eyes will go to the right answer. That's the skill. That suppose you are dicey about a question, you know something partly about a particular topic, not great, right? Ideally, I want you to know everything, but suppose you read a topic, you know only partly some part of cardiology, but I want you to develop a skill that your eyes go to the right answer, and that comes with practice. The number of days to be dedicated out of 15 days preparation time for especially cardiology is at least 4 days. It's 4 days to be dedicated to all the lectures, which can be listened at 1.2x, and minimum is 8 hours of study. Coming to neurology, I know it is a dry thing, but I assure you the fact that if you invest minimum 3 days into reading neurology, listening to neurological aspects that I've explained, you can use English, you can use English version, whichever you are comfortable with, and rather I have now increased the stakes. What I mean by increasing the stakes is I have now included a rider till your eyes water. Study till you drop. Study not only for 8 hours, if possible study 8.5 hours, study 9 hours till eyes water, because I understand when you will sit in front of a computer that long, your eyes will get tired. But then guys, you need to put this effort if you have to come in the top 1000 rank. The important topics in neurology which are to be covered are epilepsy, EEG, myasthenia gravis, multiple sclerosis. Comparison of Guillain-Barré syndrome with transverse myelitis versus CIDP. The cutoffs have to be known. Stroke interventions are always asked in every exam, whether it's JIPMER, whether it's AIMS, whether it's PGI, it's NEET exam, they always ask you for stroke interventions. You need to learn how to differentiate between Parkinson's disease versus Huntington's disease versus progressive supranuclear Gauge palsy versus multi-system atrophy. And I've done that comparisons in the app so that you are able to recall the data fast. And intracranial space occupying lesions like brain tumors and neurocysticercosis are always asked. So obviously you need to do everything in neurology, but these that you're seeing are topics which you should be able to, attempt without having to getting stressed out. I mean, these are topics where your eyes should be hunting for the answer. And it's very, very simple. It is a very easy thing, neurocardiology are very easy topics. It is just the fact that because we have in our mind created a false thing that, okay, there is so much. I agree. The vastness in internal medicine is the problematic issue, but topics are very simple and straightforward. It's simply a disease. Patient comes to you with a particular problem and you write a medicine for it. So believe me the fact that if you are going to dedicate first 7 days of your preparation, only 2 topics will be covered. What are those 2 topics? 4 days for cardiology, 3 days for neurology. So most people start, messaging by the 7th day, sir, only 2 topics are completed. I told you now, initially your performance will be very, very limited. I don't want you to start from here and start decreasing your performance. I want you to start at bottom and start upgrading your performance. So first 7 days out of 15 days, you will do 2 important topics. But believe me, if you do this for the next 7 days of your life, it's going to be a game changer for you. It's going to change your attitude. It's going to change your productivity. It's going to change the way you react to situations. I'll say in Hindi, cardio neuro जिसको आता है, उसको बाकी सब्जेक्ट्स भी आते हैं. ये नहीं कह रहा बहुत डिटेल में कार्डियोलॉजी में, कोई रेयर फैक्ट्स नहीं बोल रहा हूँ मैं तो रूटीन बातें कर रहा हूँ यार कि आपको एट्रियल फिब्रिलेशन और एट्रियल फ्लटर का ईसीजी पता है, उसका ड्रग चॉइस पता है. मल्टीफोकल एट्रियल टैकीकार्डिया में डीसी शॉक नहीं देते, क्यों नहीं देते, उसके रीजन समझ में आना चाहिए. It's not very high-fi information that I'm talking about. Routine चीजें, routine stuff is what is asking in the exam, and you should be able to do that. So neurology and cardiology will take up 7 days, but believe me, अगर इसको कर लिया, right? और मैं चैलेंज देके बोल रहा हूँ आपको, करके दिखाओ, कर लोगे, हो सकता है. तो आप खुद देख लेना, नेक्स्ट वीक से आपकी जो बॉडी लैंग्वेज है ना सर, वो चेंज हो जाएगी. अब 8th और 9th डे क्या करना है, तो एंडोक्रोलॉजी पढ़ना. अब एंडोक्रोलॉजी में क्या पढ़ना है, तो स्टार्ट कहाँ से करना है, इंसुलिनोमा से और डायबिटीज के कॉम्प्लिकेशन से, क्योंकि डायबिटीज वाइटिस तो इजी टॉपिक है, उसमें ड्रग्स तो पढ़ लोगे, बट द कॉम्प्लिकेशंस पार्ट आर अगेन टू बी डन वेरी थॉरली. देन कैल्शियम मेटाबॉलिज्म इज ऑलवेज आस्क्ड. I mean, any exam you look at, they've always asked about calcium metabolism, especially treatment of hypercalcemia. Hypocalcemia, tetany is easy, but hypercalcemia is something that you need to put some effort on. Cushing syndrome, workup is important. You should know what is the screening test, what is the investigation choice, difference kya hai, what is low dose dexamethasone, what is high dose dexamethasone, and why are they used. That is important, and you can listen to the English part whenever you are in doubt. Then you are supposed to study regarding glucocorticoid deficiency. We study Addison disease. Question kya पूछता है, glucocorticoid deficiency. We study pheochromocytoma. What does he ask? Paraganglioma. We study hypothyroidism. What does he ask? Myxedema, coma. And he talks about Hashimoto's encephalopathy. So the examiner is asking you topics which are given at the end of a particular subtopic. That is from where he is picking up the question. So when you will listen to me, you will realize the fact that lots of time I have started the discussion by rather talking about rare facts. The reason for that is this is an app which is basically designed for hitting the nail on the head. That is, whatever they're asking in the exam, those topics have to be studied. No? Because normally when somebody talks about diabetes, English part whenever you are in doubt. Then you are supposed to study regarding glucocorticoid deficiency. We study Addison disease. Question क्या पूछता है? Glucocorticoid deficiency. We study pheochromocytoma. What does he ask? Paraganglioma. We study hypothyroidism. What does he ask? Myxedema, coma. And he talks about Hashimoto's encephalopathy. So the examiner is asking you topics which are given at the end of a particular subtopic. That is from where he is picking up the question. So when you will listen to me, you will realize the fact that lots of time I have started the discussion by rather talking about rare facts. The reason for that is this is an app which is basically designed for hitting the nail on the head. That is, whatever they're asking in the exam, those topics have to be studied. No? Because normally when somebody talks about diabetes mellitus, they talk about HbA1c and stuff like that. And you will notice that I have rather talked about hypoglycemia, and I talked about insulinomas also. Similarly, when it comes to, let me say, pituitary tumors, we study acromegaly. He will ask you about a non-functioning pituitary tumor. But I assure you the fact that if you follow the list that I've said, you have to study everything, but these topics are the minimum that you should be knowing. And if you do them on the 9th and the 10th day, by 10th day of your preparation, you're done with only 3 topics, that is cardio, neuro, endo. But I assure you the fact that you have covered a big chunk. Now are the smaller topics coming up, and the reason why I want you to invest or start doing rheumatology later is because in rheumat it's all about antibodies names. No, if you're gonna dedicate 3 days into rheumatology and maybe 1 day into cardiology, not a right approach. I want you to put more time into cardio, less time into rheumat. And what are you gonna read in rheumat? We start with SLE. Okay, you're gonna start with vasculitis. You're going to listen to the sarcoidosis part, antiphospholipid antibody syndrome, comparison of dermatomyositis with polymyositis with inclusion body myositis. Read about Crus syndrome. So read about the entire domain, but these are the topics that I want you to focus upon. I mean, rheumat is something which is mainly about antibodies. If you get the names right, your job is done. That will take 1 day. So we're now on the 11th day of preparation. First 4 days cardio, 3 days of neurology. You've done 2 days of endocrinology, rheumat. Please appreciate, if you are into 3rd year, maybe you are into your 3rd prof, or you just entered into final year, you can take a little longer than this, but don't make it beyond 1 month. I mean, medicine beyond 1 month is not going to be productive. You will compromise on other subjects, no? Because you have 19 beautiful subjects to read. All demand time. So be judicious in your approach, be judicious and dedicate a particular amount of time every day to this particular subject. And I assure you, this all or none law works all the time. It worked for me. I also tried integrated earlier. I tried, okay, I will read rheumatic heart disease from pathology, then I will read about pharmacological aspects of penicillin and drugs for treatment of chorea from pharma, and then I'll try to integrate with medicine. It never happened. It was always a dream for me. That integration occurs in the second reading. By second reading, you will be wise enough to understand how to integrate. So then you have to trump GI in hemat again at about 1 day each. The speed in GI will be 1.5x because GI, Peutz Jeghers, Whipple's disease, esophagitis, you all know about it. But yeah, you need to read about Zollinger-Ellis. You need to know about which is the investigation that is the best imaging modality for Zollinger-Ellis and what is the test for diagnosis. Hepatology again is important. Do read about hepatopulmonary syndrome, hepatorenal syndrome, because they're given in the end. Read about cirrhosis complications, Ray's, Wilson's disease, and that will take approximately 1 day at 1.2x. But I assure you the fact that once you reach the stage of doing hemat and kidney, I have dedicated 1.5 days for kidney, 1 day for hematology. Why? Because hemat, if you want to do first, it will consume a lot of time. So what are you going to do? Pathology first. Believe me, for pathology, all you need to do is first do all the image-based questions of pathology related to hemat. Because you should know what is the difference between acanthocyte and echinocyte. Acanthocyte also has spikes, echinocanthocyte also has spikes. How do you differentiate? Acanthocyte, remember from alphabet A, it will have asymmetrical spikes. Echinocyte begins with E, it will have equally distributed spikes. So you have to know how a echinocyte looks like, how does a schistocyte look like. So I would suggest you to dedicate at least 3 to 4 hours into image-based session of patho. Then listen to all the hematological malignancies, the treatment part. You want to do the entire thing, great. But the treatment part has to be listened from internal medicine. That would take up about 1 day of your time. But in kidney, what is the most important thing? Electrolytes. Everybody begins with nephrotic syndrome, nephritic syndrome. इतनी बार तो पढ़ लिया यार, nephritic पे क्वेश्चन आएगा तो कर लोगे. गलती कहाँ पे होगी? हाइपोनेट्रीमिया. वो हाइपोनेट्रीमिया का करेक्शन पूछता, जैसे जून 2020 उसने हाइपोनेट्रीमिया करेक्शन पूछा. Exact verbatim values, if you go through the electrolyte section of the app, you will notice exact values are discussed. A person came with sodium of 120. How much is the correction of sodium that you need to give? Exact values is what I've discussed. So please appreciate electrolytes are to be listened at 1x only, and electrolytes are to be studied at least twice, maybe even thrice, because majority of questions that come on kidney and electrolytes would be revolving around the aspects that I've discussed. It's about a 2.5 hour lecture. In Hindi, it might take a little longer time. Why in Hindi it's taking more time is because first I have to explain in English and then go on to the Hindi component. Then read about Bartter syndrome, Gitelman, renal tubular acidosis, AGMA, high unanchored metabolic acidosis versus MAGMA, normal unanchored metabolic acidosis. देखो नेफ्रोटिक हो जाएगा, पीएसजीएन का क्वेश्चन करके आ जाओगे, उसमें कोई बिग डील नहीं है, उससे रैंक नहीं मिलती है क्योंकि वो रूटीन चीजें नहीं पूछता, वो ये एस्पेक्ट्स पूछता जो मैंने हाईलाइट किए हैं. तो बहुत बारी यू विल नोटिस दैट इन द ऐप इन द किडनी पार्ट यू विल नोटिस द थ्रोम्बोटिक thrombocytopenia purpura is placed higher and nephrotic is in the last. So a lot of guys say, sir, why did you not discuss nephrotic earlier? Bhai, nephrotic syndrome is something so simple and straightforward. I mean, all of you know about Finnish variety of nephrotic syndrome. All of you know about NPHS1 and NPHS2. So उस पे तो competition है ही नहीं ना. Competition तो इस पे है कि भाई Bartter versus Gitelman versus let me say Liddle syndrome आप differentiate कर सको. Then I come to a extremely neglected part, lungs. People don't study about lungs and people don't study about mechanical ventilation strategy. Believe me, 3 topics that I'm saying, or rather 4 that I'm saying from lungs are most important for you. The most important part in lungs is ABG section. It has to be listened twice. There is always a question in every Indian exam. There's always a question on ABG. So please go through that. The next topic to be studied in lungs is pneumothorax, but that's covered even in surgery. So most people are able to solve it. Then is pulmonary embolism. Highly neglected part, pulmonary embolism, guys, submassive pulmonary embolism, massive pulmonary embolism. The questions are always asked. I mean, you need to know where do you do thrombolysis, where you don't do a thrombolysis, how can you prevent recurrent pulmonary embolism, because these are aspects that are asked. High altitude pulmonary edema. There were 2 questions in the January session of NEET 2020 on high altitude pulmonary edema. That's a separate lecture that I put in the emergency medicine section. So if you go through the emergency medicine section, there is some parts of lungs which are covered. High altitude pulmonary edema, mechanical ventilation, and ARDS. Treatment of ARDS, that's most important. You would have read about ARDS from patho also, but listen to the part that I have also explained about differentiating between cardiogenic and non-cardiogenic pulmonary edema. The topics list that I have mentioned are the gist and the minimum performance that is expected out of you if you are an exam going student, if you just follow a 15-day schedule that I have given you to be able to, I assure you the fact that your performance will definitely go up. Your strike rate in the questions will definitely go up, not only for internal medicine but for other subjects also. It's very simple. When you are doing cardiology and you are doing ECGs, if you know a condition, you will obviously study the drug of choice for that condition. You will also realize when are you supposed to answer synchronized cardioversion versus a non-synchronized cardioversion. I mean, a lot of people draw a blank. They say, I do not know difference between, I'm talking about MBBS doctor, he says, I don't know difference between cardioversion versus defibrillation. And in the app part in emergency medicine, I have explained what do you mean by defibrillation, what do you mean by cardioversion, what do you mean by synchronized versus non-synchronized. So if you are gonna rather put your heart and soul into, because if you have taken me to be a mentor, if you have come to my app, I assure you the fact that if you follow the rules of the game that I'm teaching you, your performance is definitely gonna go all the way up. Your graph is gonna go up. Before listening to this, I assure that if you had started the app on your own, first day the performance is on the top, then performance starts going down, then it is fluctuating. I want constant performance. In the first reading, it is constant. In the second reading, it starts going up, then it starts going up. So we are going to create a step ladder pattern for enhancing our mental strength. And that is all that matters. My words are keep hammering, keep focusing, keep studying on a daily basis. Habits don't take months to develop. There might be motivational speakers who will say habit will take 30 days to develop, 60 days to develop. Habits, we human beings, doctors especially, they have neuroplasticity. You can enhance your performance in as little as 5 days. Just follow what I have said. Just remember these hacks that I've said. Eat the frog, do the worst thing as the first chore in the morning, select the most difficult topic for the first thing in the morning, and don't listen to what your friends are doing. Don't follow what people are doing. Don't listen to the fact that I have done 3 revisions, 4 revisions. doesn't matter. Doctors should be having photographic memory. That's again important thing. Whatever you read should be imprinted in your brain. So how did I compensate? How did I compete with my college friends? They were fast. I was slow, but I had a photographic memory. Whatever I read, it retained in my brain better because I was relatively slow. So I was looking at the data for longer duration. So when it comes to remembering the information, in MCQ, lots of time you remember, okay, this is given in notes, this is read in the book, this is what the teacher said. So the ability to connect back, that I had, which my friends were lacking because they were trying to be too fast. So in the end, it evened out. When it comes to the ranks, it evened out. I was able to give them tough competition. I'm not saying that I was able to defeat them. I never intended to defeat them. But yeah, I was able to give competition to them, and I ensured the fact that I practice my art every day. I practiced studying every day. They used to study for few days and ask performance, right? I did every day. So slow and steady definitely wins the race. Thank you so much for hearing me out, and straight away start with the cardiology section.